Hello, I'm Kelly Schultz. This is a presentation for Leadership and Management for Nurse Executives at Capella University. I am presenting a plan to improve throughput from the emergency department to the inpatient setting, with the end result being a decrease in wait times in the emergency departments. The goals are to move the organization toward the triple aim: improving patients' perception of their care, an improvement in health of the community served, and reducing the cost of care. Crowding and boarding in the emergency department is shown to have increased morbidity and mortality rates and a decrease in quality of care. Therefore, eliminating boarding will improve patient safety. The strategic plan addresses changes in process, policy, and procedure to open the bottleneck that results in boarding patients in the emergency department. When patients are required to wait for extended periods of time they do not trust we're meeting their needs. We fail to fulfill our promise of bringing the nation's best health care to our communities and our mission of strengthening the health of our community one life at a time. Improving patient flow will improve care across the continuum at Atlantic Health. Administration or the executives are the primary stakeholders and the driving force when changes must be made. Without their support, no plan will succeed. A formal presentation is necessary for documentation and transparency. The balanced scorecard approach is used to communicate with stakeholders. The balanced scorecard assesses the plan from 4 different perspectives: finances, care to be provided to the patient, employee satisfaction, and learning and growth, which addresses third-party relations, technology, and human resources. Addressing the organization as a whole will improve the implementation process and guarantee the change is sustainable. Any plan should support the mission, vision, and values. These statements are the core ethics of an organization. Atlantic Health boasts the nation's best health care. Therefore, it's necessary to continue to improve. It is vital to convey to the stakeholders the relationship between the plan and the mission, vision, and value statements. The goals and steps for aligning the care setting to the main objectives are listed here. Healthcare quality is based on patient satisfaction. One aspect of the triple aim is care based on the patient's experience. The gold standard for admission decision to transfer time is 60 minutes. Decreasing the amount of time it takes to get a patient out of the emergency department and into an inpatient bed will decrease the bottleneck that forms due to boarding. Patients who leave without treatment, or LWATs, are consequences of overcrowded emergency departments. This affects revenue for the facility. Decreasing the number of LWATs is desirable. Changes to be made include both long and short-term goals. Currently, there is a culture of every man for himself, so to speak. Increasing communication will help foster collaboration. A bed teleconference twice daily, including the charge nurses at all 3 EDs, the house supervisors at both hospitals, and the bed coordinator once one is established, will help with transparency and allow brainstorming to move patients from the emergency departments to the inpatient setting. Long-term goals include changes in practice, which will require changes in policy and procedure. Policy change will need to include physician and staff education and buy-in. To increase the likelihood of success, good communication with all parties involved is imperative. Rabin and all recommends utilizing technology for coordination of all the beds within the organization, in addition to adding a bed coordinator. These goals link back to the main objectives. The action steps will see the goals to fruition. Healthcare has historically been physician-driven. Doctors bring patients. Hospitals cannot function without patients. Therefore, there has been a culture of keeping physicians happy. Change in the hierarchy of physician power to a partnership improves patient care, allowing the organization to better serve all the patients who present to the hospital, as opposed to requiring the patients to work around the physician's schedules. Better distribution of elective admissions is another practice change that can alleviate some of the congestion that causes the bottleneck as well. Pushing physicians to see patients for discharge as early as possible will move the discharged patients, freeing beds for the admissions from the emergency department. Emergency departments often have patients in the hallways. Moving the patients who are boarding to the inpatient hallway will make more room in the emergency department, and when the floor has patients lining the hall, it will encourage them to find a room more quickly. Currently, the inpatient setting is immune to the struggles of the emergency departments. They do not feel the pressure of overcrowding. Inpatient nurses doing a rotation through the emergency department would promote understanding of the need to move patients out of the emergency department more rapidly. Leadership supporting the emergency department shares the vision of decreasing crowding and moving patients along the continuum will encourage staff buy-in. There is no easy fix to the increasing needs in healthcare, but putting these actions into play will reach the objective of reducing overcrowding in the emergency setting. Success of the initiative will be reflected in an improvement in the metrics. The organization currently uses the Press-Ganey survey in conjunction with the HCAHPS, or Hospital Consumer Assessment of Healthcare Providers and Systems survey, to evaluate patient satisfaction. We expect to see an improvement in these scores. The emergency dashboard will show a decrease in the number of patients who have a disposition of left without treatment. The dashboard will also reflect a decrease in the amount of time it takes for the patient to be transferred from the emergency department to an inpatient bed. The National Database for Nursing Quality Indicators, or the NDNQI survey, is completed annually to evaluate staff satisfaction. Improvement in the scores will reflect success in staff satisfaction with their job. It is not always possible to accomplish everything when goals are set. The two more important goals, which are highlighted in red, are to increase patient satisfaction and move patients out of the emergency department more quickly. When these two metrics improve, the other two will follow. If there are more beds in the emergency department, there will be fewer left without treatments because patients will move from the waiting area into a treatment room more quickly. With the decrease in stress from overcrowding, it is expected to see an improvement in staff satisfaction. Hospitals often leave emergency departments to bear the brunt of a never-ceasing barrage of patients. Inpatient settings are often inefficient when it comes to bed management. Changing the culture of the facility from one with business hours to a 24/7 operation by expanding times for diagnostic services will improve productivity. Improving the scheduling of elective admissions, expediting discharges on weekends and holidays, changing the process of bedding patients from specialty-specific units to better distribution among the hospital will improve patient flow. These changes will require physician participation and cooperation. Incorporating ethics is based largely on the mission, vision, and value statements. This is the organization's word to the community served. Healthcare facilities have a moral obligation to their patients to meet their needs, providing the best care available and continually improving the quality of care. Regulatory bodies govern every aspect of healthcare. Regulations are not the driving factor of this initiative, but need to be incorporated to ensure the organization is compliant with all changes. To ensure Atlantic Health is compliant, the compliance officer will be involved in every aspect of the initiative to ensure the obligations are fulfilled. This slide lists the promise and the mission, visions, and values of Atlantic Health. We're promising the best health care available for our patients. Ethically, we are obligated to improve. Decreasing overcrowding in the emergency department will do just that. The role of the nurse leader begins with the conception of the plan. Using Lippitt's change theory, the nurse leader must recognize there is a problem and conceive a plan for improvement. Lippitt's theory coincides with the nursing process of assessment, planning, and implementation and evaluation. Phases 1, 2, and 3 assess and establish there is a problem and the need to develop a plan. These phases also consider the desire and ability to change and the motivation of stakeholders. This is when the plan is dreamt and then proposed to the stakeholders. Phases 4 and 5 are a time of planning. This is when roles are designated, a timetable is established, and change strategies are selected, evaluating costs and addressing resistance. Phase 6 is implementation. The nurse leader must put into place the changes, communicating to the staff and following up to ensure there is participation. Leadership must ensure they are clear about roles and tasks and are committed to their staff, ensuring they have what they need for a successful change. Phase 6 is a time for coaching and training to ensure the change is accepted. The evaluation phase, or phase 7 of Lippett's theory, is termination, the helping process. The staff should have new habits by this time. This is also a time to evaluate the metrics to see if the initiative has had the desired effect. Prior to pursuing change, nurse leaders should evaluate their leadership capabilities and style. Each leadership approach has a place in the healthcare arena. Transactional leadership is task-oriented and limits the scope, focusing on completing assignments as opposed to the whole picture. A transformational approach, often preferred, seeks to engage the staff and share a vision. Situational leadership tailors the style to the situation at hand, and it meets the needs of the followers from novice to expert. Effective leadership includes influence, clarity, commitment, self-image, price, and behavior. When considering a major change, the type of change needed will have bearing on the leadership style. If change is dictated, an autocratic style may be necessary. Autocratic leaders are rigid, commanding followers as opposed to eliciting buy-in from the staff. Democratic leadership fosters collaboration and is an effective style for promoting change. A laissez-faire leader is not likely to be effective. For the greatest chance of success, transformational and situational leadership are ideal for a long-term plan. The previous slide reflected the best leadership approaches and styles for this initiative. My personal leadership style is democratic. I wish to lead as opposed to direct. My approach to leading tends to be transformational, sharing my vision with the staff, seeking buy-in and opinion from followers. I have the ability to shift to situational leadership if necessary. I'm able to give directives, though it is not my preferred method. I've assumed the role of leader throughout my nursing career, whether formally or as a leader among my peers. I have had many years of experience in nursing, both on the floor and in the emergency setting, so I have an understanding of the dynamic of both areas. I believe in the initiative and the positive impact it can have on both the emergency and inpatient settings. I have the desire to improve my organization and the ability to approach administration and physicians alike. I'm the best choice for leading this initiative and will select a team who collaborates together to provide the best care available, ensuring increased patient and staff satisfaction, decompressing the emergency department, and more efficiently moving patients along the continuum here at Atlantic Health.